interlocked. Rotationally rub backwards and forwards the clasped fingers of your right hand in your left palm and vice versa. Once your hands are dry, they are now safe.
Staying at home is a key measure established by governments around the world to slow the spread of COVID-19. We have been told to cover our mouth and nose with a mask, sanitize and wash our hands frequently while we keep a distance of 6 feet from persons around us. Plus, there is quarantine orders and isolation, and in some cases a lockdown. These are all critical parts of the government's comprehensive response strategy, which we must take seriously if we are to prevent the spread of COVID-19.
That we're moving into another phase of the COVID-19 pandemic in Jamaica. We are moving now to what is described in clinical terms as community spread, which means that we will see more cases emerging in communities around the country that have no immediate link to someone who has traveled with the virus coming into Jamaica. It is expected, it is understood that it will happen. It is the way the virus works, and that is the case in all countries. So when you hear us say we have cases under investigation, which sometimes we put in the releases, it means that some cases don't have an immediate and obvious connection with an original person who traveled in. Remember, all cases are brought in, are imported, but after a while, it becomes very difficult to determine when it came in and who brought it in. That would lead to someone having it. So it's important because the country needs to appreciate that over time, the virus is going to move across the country and you're going to have more persons getting the virus. It is not an indication of failure on the part of the public health officials, on the part of the government, on the part of the country. It's just the way it works. The virus is highly contagious, very easy to pick up, as the CMO said earlier. You go into a public bathroom, you put your hand on the surface, somebody was there who coughed on it, you pick it up. You're talking to someone too close on a public transport, in the market, in a shopping center, in the supermarket, you pick it up because of the droplets. So it's very easy to pick up. And over time, a lot of people are going to pick it up. So we're moving in that phase now, and Jamaicans need to understand that, which is why they need to observe the measures that have been introduced, because we want to not make it too rapid. So in a sense, and I'm going to introduce a term here tonight that has to be dealt with very delicately. In a sense, we're moving in a phase that could be described with the efforts of public health as a managed spread. Managed spread meaning we want to slow down. We don't want it to spread too fast. We know it's going to spread anyway. Over time, we don't want it too fast, because if it happens too fast, it means more persons are going to turn up in the hospitals where we don't have enough beds, enough doctors to treat them. And the catastrophe of that is manifested by just watching international news. You see it on the big newscasts where people are waiting in lines to get into a hospital, where people are dying at home because the hospitals don't have enough facilities. We are trying to prepare for that, which is why we're buying up new beds and ventilators. But if we don't manage the virus, then it could spread too fast, too quickly, and could be a real challenge for public health to respond. So that terminology of managed spread is something that Jamaicans are going to have to eventually adopt, recognize, and understand. And that's the community spread phase that the efforts of public health have to be working on. The second that I'd like as a takeaway is the issue of asymptomatic versus symptomatic. Clearly, symptomatic means you have symptoms. You cough, fever, respiratory issues, breathing problems. The more severe, the more requirement for hospital care. And we do hope that we have a minimal number of that, but we have a projection as to how many we will have. Some may be extremely severe, so you require high dependency or ICU, which is when you need the ventilator to help you breathe. That's the most severe. The persons who are most susceptible to that are persons who have underlying conditions, diabetes, hypertension, cancer, recovering patient, cardiovascular disease, obese, overweight, that sort of thing. They will more than likely have a more difficult time with the virus because their immune system is compromised, which is why exercise is good, which is why eating well is good, which is why boosting your system with your vitamin C, etc. is good. The other is the asymptomatic person. And what the studies and the projections are saying is that the majority of persons who have the virus won't feel any symptoms. They are asymptomatic. They won't have the fever, the cold, the headache, and so on. Now, that could mean hundreds and thousands of us in Jamaica based on our population. And it's likely to mean that over time. So you won't need hospital care. And you won't have enough hospital beds to put people in hospital who are asymptomatic. The response to that, therefore, is that the country must come to terms with the reality that many will have the virus and will have to be treated at home. Take the medication, basic stuff that the doctor will tell you, or over the counter. I guess over time we'll have to inform people on that. Stay out of interacting with other persons. Continue to try and get your nutritious meals, but stay at home, rest until you get over the virus. And I'm saying to Jamaica, increasingly, expect persons living in your community, maybe in your household, who are positive for coronavirus, but not sufficiently ill to go to hospital, and we're going to have to put you in, you're going to have to recommend that you stay at home.
Jamaica continues to chart new frontiers for tackling the challenges brought about by COVID-19. On Tuesday, April 12, the Ministry of Health and Wellness commissioned a new state-of-the-art cobas machine at the National Public Health Laboratory, which increases the country's testing capacity in light of the global pandemic. The new machine allows for over 1,000 samples to be tested daily in double 8-hour shifts.
That's a very welcome addition to what we have already in place. And I think it will certainly increase the testing, and of course in deploying the mobile units to go out, as well as the different testing protocols that we have. What we have effectively done is created the capacity to collect more samples nationally, whether it is through contact tracing or whether it is through our sentinel sites, meaning persons just turning up at the hospitals or the health centers. We are in a situation where we can do significantly more testing, and that's a very positive development.
Previously, most of the country's testing was concentrated at the National Influenza Center at the University Hospital of the West Indies. The health minister thanked the team, who he said are well-trained and ready to champion the cause on behalf of the Jamaican people. Chief Medical Officer Dr. Jacqueline Bisesa Mackenzie said that sampling capacity out in the field has been boosted.
We have been getting the samples coming in from the health centers, from the different hospitals of all persons who have any kind of respiratory illnesses. And we have also started using the mobile team that is helping the health departments in getting the sampling done, and this is going to be particularly useful when we have any kind of outbreaks in communities and we need to do the contact tracing and we have to do the testing at the same time.
As the fight against COVID-19 steps up, with corporate Jamaica playing a role, the Southern Regional Health Authority was gifted 10 mobile vital sign machines on Wednesday, April 22, valued at more than $1.8 million from BMR Jamaica Wind. The new machines monitor the vital signs of a patient, including their blood pressure, pulse, and temperature, which allows doctors and nurses to monitor and deliver treatment in a more timely and focused manner. The Southern Regional Health Authority administrates public health care in the parishes of Clarendon, St. Elizabeth, and Manchester. COVID-19 has brought about a new normal for many of us, and for persons in the tourism and hospitality sector, it's no different. Online training has increased in light of the social distancing requirement implemented to prevent the virus from spreading. The Ministry of Tourism, through its training arm, the Jamaica Center for Tourism Innovation, JCTI, is offering tourism workers free online courses. The ministry is partnering with Heart NSTA Trust, Universal Service Fund USF, University of the West Indies UWI, National Restaurant Association NRA, and the American Hotel and Lodging Educational Institute AHLEI. All courses will include certification examinations. Successful candidates will receive certificates from NRA, AHLEI, or Heart NSTA Trust as required. To register, persons can go online at www.tef.gov.jm/Jamaica-Center-of-Tourism-Innovation or call the JCTI at 876-920-4926.
While these are trying times, we must remember that there is life after COVID-19 and the tourism sector will rebound. While we don't know the time or the hour, we have to be prepared to jump back in as if it never stopped. I want you, all tourism workers, to be better prepared. And we want you to recognize that leaving this period of this pandemic must not leave you as you were before, but indeed much better off. There is no better time, therefore, than now to retool and upskill. It is a smart investment to stay resilient, which will pay handsome dividends when the tourism sector returns to normal.
It's important to keep a good frame of mind and avoid being overwhelmed by the fear factors surrounding COVID-19. And as you try to process all the information floating around, we hope you'll find this next feature useful.
It is normal to feel sad, stressed, confused, scared, or overwhelmed during a crisis such as that caused from the COVID-19 pandemic. But there's no need to. For one, we must first inform ourselves about this disease through reliable sources to determine our risk and precautions to take. This can go a far way in calming our fears and ensuring our safety. Keeping in touch with family and friends and talking to people you trust, even as we practice social distancing, can help prevent panicking and keep you in good spirits. If you must stay at home during this period, try to maintain a healthy lifestyle of proper diet, adequate sleep, and regular exercise. Don't use smoking, alcohol, or other drugs to deal with your emotions. If you feel overwhelmed, talk to someone about it, a healthcare provider or counselor that you can call. Ensure that you're fully engaged in something constructive to occupy your time. An arrangement with your employer to work from home where possible is good in helping to keep up normal daily routines. Limit the time you and your family spend watching, listening, or in conversations about COVID-19 that you perceive as scary or upsetting to avoid being overwhelmed. Make sure you are in the know generally, but try to engage more in other things or change the topic of your conversations to things you enjoy talking about. Draw on the skills that have helped you manage previous adversities. It's important to try to maintain some sort of daily agenda so that the days are not wasted and you'll feel more accomplished. Focus on activities that make you feel happy, like reading a book, watching your favorite show, playing video games with your family, or telling stories. Do some gardening or chores around the home too. Children too need to be provided with the information to help them understand the risks without becoming scared and confused. Use age-appropriate language to teach them about hand washing, cough and sneezing etiquette, and social distancing. It's also important to reassure them about what could happen if they start feeling sick and may have to go to the hospital so doctors can help them feel better. In the meantime, ensure their learning continues even as schools are out. And give them extra time and attention. Listen, speak kindly, comfort them, and of course, make time to play. When it comes to easing fear and anxiety around COVID-19, just consider that once we do what's necessary to protect ourselves and prevent spread, we should be well. If we do get sick, rest assured our doctors are trained to manage the illness and help us recover. And yes, while we maintain proper cough etiquette, cover our noses when we sneeze, and practice social distancing, we must treat each other with care and respect. Don't be startled by every cough or sneeze. Remember, not everyone who does has the virus. Take care of yourself. Support others. Don't panic.
We really need to cut the hate and work together as a country, as communities to overcome. I really do not want to hear about any case of persons threatening people, abusing persons because they hear that they have the virus. And also for healthcare workers, we don't want to hear that we are also not cooperating with our healthcare workers.
The entire family is spending more time at home as a precaution against COVID-19. But within the home, we all need to pay special attention to maintain safety against possible hazards, such as a fire. Let's look at how we can ensure our homes are fireproof.
Fire! Fire! My bed, my clothes.
Same script, different day. What's worse, sometimes a human being, even a child, dies in these unfortunate situations. The loss of lives and valuables as a result of fires is impacting those who remain behind. The mental effort to get up from the ashes. Taxpayers too are being burnt, as more dollars are being shelled out for fire emergency operations. Homeowners must implement fire safety plans.
It's important for us to fireproof our homes because we have our families and we normally have strict guidelines as to how you operate within the home, or you store your chemicals as it relates to your kitchen, how you manage your heat sources, how you handle your plugs. So the safety measures that you take as it relates to the protection of your children.
Here are a few situations you must avoid to prevent losing your home to fire. Finally home from a tired day at work. The first thing many people do is get something to eat. Now, this is when a fire safety sin is usually committed, having a cigarette while tired or the stove is left on. What else at home are you not doing safely? Like this, using a computer or mobile phone on the bed. So they should not be used on flammable surfaces such as beds or sofas.
Leaving your cell phones on your bed can trigger the ignition temperatures of that spread or sheet and can actually cause a flame. So we encourage you not to leave your cell phones unattended. It's an active source of heat, and worse when it is charging. It has caused many house fires based on our statistics.
Between